Welcome to NCLEX Bites. NCLEX Bites are bits of content that will help you to pass your NCLEX exam. What they are is we've broken things down into 5 to 10 minute long videos that you can listen to, watch when you're just have a few minutes to study. Most of the content we've gotten for the NCLEX Bites are things that have come from people who've recently taken the test. If you want to find more information, PDFs and images for further study, you can go to NCLEXreviewonline.com. Just click on the NCLEX Bites link. The content plan for this series is to do videos, then PDFs, then flashcards, and then also some things for further study. We're going to have 4 sets. If you want more, if you're watching this video on YouTube, like and share the video. Every 100 likes or so we'll post another one. Facebook page, you could find another one there, hint hint. Or if you're watching this on Facebook, then you can check out our YouTube channel. Link should be provided for you. And of course our NCLEX Bootcamp course has all of them. And we have a trial, 24-hour trial where that you can test out to see if it's something that you'd be interested in. Our content, we're going to have 4 sets. Set 1, which you're watching now, Precautions and Procedures, Meds and Antidotes, Part 1 and 2, and then Peds. Set 2, we're going to have some random 1 and 2, Procedures 2, Maternity, Lab Values and Nutrition. In set 3, we're going to have Post-Op and Mental Health, another set of Peds, and then MedSurg Plus. And then set 4, Diseases and Conditions, Part 1 and 2, and then some random questions. So this set of NCLEX Bites are all about precautions and procedures. Again, please make sure that you check out the disclaimer on our webpage. Let's get started. Transmission-based precautions, airborne. A great way to remember this is my chicken has TB. My is for measles, chicken is chickenpox, varicella, has is herpes zoster or shingles, and TB. Or you can remember MTV equals airborne. It comes over the air. Measles, TB, and then varicella, chickenpox, herpes zoster, shingles. Private room, negative pressure with 6 to 12 air exchanges an hour, mask, and an N95 for the TB. Droplet precautions, you want to think of Spider-Man. S, sepsis, scarlet fever, streptococcal pharyngitis. P is parvovirus B19, pneumonia and pertussis. I is influenza. D, diphtheria, pharyngeal. E is epiglottis. R, rubella. M, mumps, meningitis, mycoplasma or meningeal pneumonia. AN is adenovirus. You want to have a private room or a cohort mask. Contract precaution, think Mrs. Wee. M, multi-drug resistant organism. R, respiratory infection. S, skin infections. W, wound infection, enteric infection, Clostridium difficile. E is eye infection / conjunctivitis. Skin infection, you want to think V-chips, varicella zoster, cutaneous diphtheria, herpes simplex, impetigo, pediculosis, and scabies. Positioning. For an air or pulmonary embolism, positioning with an air or pulmonary embolism. Signs and symptoms include chest pain, difficulty breathing, tachycardia, pale, cyanotic. They have a sense of impending doom. Turn the patient to the left side and lower the head of the bed. A woman in labor with unreassuring FHR, fetal heart rate, late decels, decreased variability, fetal bradycardia, etc. You want to turn the patient on the left side, give O2, stop the Pitocin, and increase IV fluids. Tube feeding with decreased LOC position, patient on the right side, promotes the emptying of the stomach with the head of the bed elevated to prevent aspiration. During an epidural puncture, side lying, after a lumbar puncture, and also the oil-based myelogram, patient lies in a flat supine position to prevent headache and leaking of the CSF. Patient with heat stroke lie flat with legs elevated. During continuous bladder irrigation, CBI, catheter is taped to the thigh, so the leg should be kept straight. No other positioning restrictions. After a myringotomy, position on the side of the affected ear after surgery that allows for the drainage of secretions. After cataract surgery, patient will sleep on unaffected side with a night shield for 1 to 4 weeks. After thyroidectomy, low or semifallars, support head, neck, and shoulders. An infant with spina bifida, position prone on the abdomen so that the sac doesn't rupture. Bucks traction, skin traction, elevate the foot or of the bed for counter traction. After total hip replacement, don't sleep on the operated side. Don't flex the hip more than 45 to 60 degrees. Don't elevate the head of the bed more than 45 degrees. Maintain hip abduction by separating thighs with pillows. Prolapsed cord, knee chest position or Trendelenburg. An infant with a cleft lip, position on the back or in an infant seat to prevent trauma to the suture line. While feeding, hold in an upright position. To prevent dumping syndrome, post-op ulcer/stomach surgeries, eat in a reclining position, lie down after meals for 20 to 30 minutes. Also restrict fluids during meals, low carbohydrate and fiber diet, small frequent meals. Above the knee amputation, elevate for the first 24 hours on a pillow. Position prone daily to provide for hip extension. Below the knee, foot of the bed elevated for the first 24 hours. Position prone daily to provide for hip extension. Detached retina. Area of detachment should be in the dependent position. Administration of an enema. Patient in the Sims position with knees flexed. In anatomy, the supratentorial region of the brain is the area located above the tentorium cerebelli. The area of the brain below it is the infratentorial region. The supratentorial region contains the cerebrum, while the infra region contains the cerebellum. After the supratentorial surgery, the incision is behind the hairline. You want to make sure to elevate the head of the bed 30 to 45 degrees. After infratentorial surgery, the incision is at the nape of the neck. Position the patient flat and lateral on either side. During internal radiation on bed rest while implant is in place. Autonomic dysreflexia, hyperreflexia. Signs and symptoms are a pounding headache, profuse sweating, nasal congestion, goose flesh, bradycardia and hypertension. Place client in a sitting position. Elevate the head of the bed first before any other implementation. Shock, bed rest with extremities elevated about 20 degrees, knees straight, head slightly elevated, a modified Trendelenburg. Head injury, elevate the head of the bed 30 degrees to decrease the intracranial pressure. Peritoneal dialysis when the outflow is inadequate. Turn patient from side to side before checking for kinks in the tubing. Lumbar puncture after the procedure. The client should be placed in the supine position for 4 to 12 hours as prescribed.